I'm Vicki Hogarth and welcome to Southwest Magazine. My guest today is New Brunswick's Health Minister, the Honourable Dorothy Shephard. Thank you for being here today, Minister.
It's my pleasure. Thanks for having me.
I'd love to just start off a little bit by talking about what brings you to St. Andrews. I do want to talk about the health plan for New Brunswick that was unveiled last week, but what brings you to St. Andrews specifically?
So today we were talking about how communities can participate in community health. And so today we were here at the St. Andrews Wellness Centre, a real crown jewel in New Brunswick's healthcare system. We launched the health plan last week, as you mentioned, and one of the things that we knew from doing our across the province consultations was that healthcare is probably the most important topic on most people's minds, and they want to be able to receive healthcare in their community. And so with that, we knew that we needed to have community participating at many different aspects of it. The Community Wellness Centre here is a great example of how we collaborate with other professionals, physiotherapists, in some communities pharmacy, to bring that health care to a new level in community. And we believe that municipalities have a role to play in our recruitment efforts. So we had good conversations about that today.
I know that you've promised in the health plan to eliminate wait times by summer 2022, which is coming up. And I know a lot of that has to do with bringing in technology. So for people who still aren't aware, how will that work?
So the primary care network is going to be very, very important. As you know, we have a number of people on Patient Connect, and they're waiting for a family physician or a nurse practitioner, a primary care provider. And so as they're transitioning from one primary care provider to another, they're in a limbo where they don't have access to primary care easily. And so that increases our calls to the emergency rooms, and so we want to find a way to fill that gap. And so we have developed the primary care model. We presented it to the New Brunswick Medical Society during our negotiation process. They took it to their family physicians, asking for volunteers to become part of this primary care network. And so we achieved a higher number of hours than we requested. And so this will ensure that all of those individuals who are on the Patient Connect list will still have access to primary care. The province will provide an electronic medical record system, and Medivie will administer the appointments. And so there will be a triage nurse who understands the needs, will help decide if it can be a visual or a virtual appointment or if it's in person. And I was very insistent that this must include in-person visits because that is a connectivity that cannot be lost. So based on that assessment, we're looking at a same day to 5 to 7 day appointment time for people to ensure that they can get their prescriptions refilled, manage chronic illness, those kind of things. And I'm very excited that we will be launching it in the early New Year 22. And the timeline is that by the end of the second quarter, so that's fiscal quarter, which would be the end of September, everyone will be eliminated off of the Patient Connect list and provided a primary care clinic.
Is that sort of some of the silver lining to COVID, is that it's familiarized so many people with things like Zoom and doing things over the internet and the computer? Has that been helpful in forming this plan?
Absolutely, because we have learned so much through COVID. Virtual appointments were pretty much non-existent before COVID, but they were quickly adopted not just by providers, but by the public. And while they, I believe they fully have their place, can't be the only option. And so that's why the primary care network will be a combination of both.
Dr. Julie Levesque-Taylor, who you met downstairs, is a great example of someone who decided to move to New Brunswick. She's originally from here, but she's been in Winnipeg a long time at the St. Andrews Wellness Centre now. How do you plan to attract more doctors, like Dr. Levesque-Taylor, to New Brunswick? Will you be working in what way with communities? I know the town played a key role in Dr. Levesque-Taylor coming to St. Andrews.
And many communities don't realize they can be a part of it. And so first of all, it's about engaging and making sure that municipalities have an opportunity to be part of the conversation when we're bringing new physicians to our province. Sometimes it happens anecdotally, maybe they summer vacation here, maybe they've reached out to inquire, and sometimes it's an absolute more direct. We want to get our physicians when they're in their third and fourth year of schooling, so that we can garner their interest.
Another silver lining maybe to COVID is we've seen many people want to move to New Brunswick. Have you noticed anything in the health care arena where you see that same trend happening there? Have there been more people expressing interest?
We've certainly seen interest, and so we'll have to take a bit more time in the next 6 months to 12 months to understand if there's a heightened interest. But we're not going to wait for that. We're gonna go after it.
Something else I was mentioning to you earlier today is obviously a lot of doctors in New Brunswick are nearing retirement age. I think it's around 35% that in the next 5 years could be in that age bracket to retire.
Yeah.
My personal doctor, I don't want to give away her age. I won't say who she is, but I think she's 78. So I might be out of a doctor in a couple of years. How do you plan to approach that challenge too? Obviously, that could mean there's a bigger void than we are anticipating.
Well, we've known about that number for some time. And I think that there have been successes we've been able to maintain for most of it. I mean, like when I speak about the Patient Connect list, I think there's about 40,000 individuals on it, but we have actually placed 37,000 in the past year. So it is a rotation, right? So we need to be aware that that's going to happen no matter what we do. And it's not just physicians. Our nursing, our RNs are at about the same level. Lab technicians, they're about 42% we're going to lose over the next 5 years. So medical professionals themselves, and indeed other professions throughout New Brunswick are filled right now with an aging demographic, and we need to be prepared and really up our game for all of this. So it will be no holds barred. It will be all hands on deck. And that's why we're going to be pulling communities into this conversation as well.
Another big goal of the health plan is to cut wait times in half for surgeries.
Yes.
Can you talk a little bit about that and how you plan to approach it?
Sure. Well, again, we go back to lessons learned during COVID. And, we didn't want surgeries to stop during COVID because we already had a long wait list, particularly, so we focused on hip and knee surgeries, and we put together a surgical advisory committee. And they were from both RHAs, Horizon and Vitalite, with working with the department liaison, and we utilized their expertise in helping us to continue surgeries. Not only did we continue surgeries during COVID, which many provinces could not, we actually increased capacity. And over that 9 to 12 months, we lowered the long wait list by up to 40%. With the hip and knee surgery project at the St. Joseph's Hospital in St. John. Now that has waned a bit, of course, with circuit breakers and REDS and our COVID reality, but at the same time we've proven it can happen. So we're going to expand that throughout New Brunswick with Surgical Advisory Committee, and then we are also going to extend it to other specialties. So we have a 24-month period whereby we'll be implementing this process, and I'm very confident that we're going to be able to see those numbers come down, and we'll be able to monitor it regularly.
Some of the work that's already underway has to do with mental health. There are 14 walk-in clinics across the province that you've been a big part of. Can you speak a little bit about what inspired this program and why you thought it was necessary? For sure.
I think the mental health sector saw that single session counseling could really benefit individuals, and we knew that if we could reach people when they're at a lower acuity of need, we're going to have greater success. And so Campbellton was our demonstration site. They were the earliest and ready to go. And for a 6-week period, in fact, they opened up 1 year ago Friday. And in their first 6 weeks, they eliminated their wait list of 37 for that community. But they also saw, if I'm not mistaken, close to 200 individuals. And almost all of them were satisfied with one visit. And some who needed further treatments were progressed on. And so it showed huge success in a very short time frame. So we had committed in the Mental Health and Addictions Action Plan that we would have 14 of them around the province, utilizing our public health offices as sort of the basis for where they would be located and where they were needed. And so that's been built on. And so the very last, the 14th one opened up at the end of October. They're working through their local wait lists, and then there'll be true walk-in clinics for single session therapies any day now.
And I know it's still early, but are you able to see any data that shows less people are using the emergency room, for instance, for mental health crises?
So it's early now. The majority of them opened up in October because they were doing all their training during the summer.
Okay.
In the single session therapy sessions. And so it's early yet, but we will be checking in. Again, our health plan clearly outlines that we're going to be validating our numbers on a quarterly basis and ensuring that we're on the right path. If we need to pivot quickly in some places or some areas, then that's why we're having such strict monitoring of our accomplishments and validating that we're getting the outcomes we want.
And was it important to start something like this right away, just because of COVID has obviously created even more mental health concerns, more crises in New Brunswick, around the world, really? Was that part of the reason that inspired it to go ahead so early?
Well, we took our 5-year mental health and addictions plan that we tabled about a year ago, and it's interdepartmental. I maintain that even the health plan could not be done in the isolation of the Department of Health. We need our partners at education, our partners at social development, justice and public safety. We need to all be a part of assessing what our services need to be. And so it was only a few weeks after we tabled the 5-year mental health and addiction plan that we had a tragedy in our community, a couple of them really. And so it really spoke to the fact that 5 years is a long time. And so we made the commitment that this 5-year plan would be accelerated to 3 years. And that's the path we're on. And again, it's interdepartmental. It is bringing all of our departments together to ensure that we're getting things off the ground and we're getting the outcomes we want. We have a deputy minister steering committee of many of our departments, I think 7 different departments, and we keep this plan on track.
Can you tell me a little bit about some of the changes that are being implemented with Ambulance New Brunswick? I know there were some unveiled last week, and how will they affect New Brunswickers?
Well, they're going to affect New Brunswickers, I believe, in a very good way. So Ambulance New Brunswick, we've had conversations, and I should say that everything that we did in the health plan was, again, not done in the isolation of the department. We used our partners in the RHAs and in community, frontline medical people who really contributed to us and how we proceeded with the plan. And so Ambulance New Brunswick was no small part of that as well. And we're going to be doing a couple of things. First, we're going to reintroduce the emergency medical technician position as an entry into paramedicine. And we're doing that for a couple of reasons. One is we need more bodies. We need to ensure that our ambulances stay on the road. So not a lot of people would know that each ambulance has 2 paramedics. But when one of those paramedics calls in sick, chances are the other partner is at the station all shift. The ambulance doesn't move. And so that's not very good for the community. So if we had an EMT who could be supportive in that position so that you have a fully trained paramedic with an emergency medical technician there to assist, that truck can stay on the road.
Okay.
That's really important. But more importantly as well, paramedics also want to do more community work. They want to work in the ER. They want to work in a wellness center where their skills can be utilized. And so we can't do that without having an option for their, to backfill their partnered position. So that's another reason. And then the second largest topic during our conversations was transportation. Mm-hmm. And it wasn't just in rural New Brunswick, it was also urban. So we know that if we can use emergency medical technicians for transportation, for transfers from one facility to another, perhaps to help someone get to medical treatment if needed. They're not high acuity of need. And so we can use an emergency medical technician instead of paramedics for those, again, freeing up the paramedic to be where they're supposed to be and ensuring that truck is on the road.
Okay, I'd love to pivot and talk about something you've probably talked to me a lot about over the last year and a half, just COVID-19.
Yes.
We did have some good news last week that 5 to 11-year-olds will be eligible shortly.
Yes.
What is the update on when those doses will be coming to New Brunswick and when we will be seeing needles in arms for that age group?
You're going to receive an update on that this week. But we do know that the doses are in Canada, the doses are being shipped to New Brunswick, and there's enough doses received in Canada for every child. And so the first doses we're hoping will happen very, very quickly. And I'm encouraging physicians and pharmacies to get ready, because I assured the Federal Minister of Health last week that we are prepared and we are ready to go. And so as soon as we get those appointments up on our internet, you'll be one of the first to know, because we want everyone to take advantage and get their children vaccinated.
What have you learned from the 12 to 19-year-old age group? Are they the majority getting the vaccine? And
the numbers are climbing all the time, and I don't have those numbers with me today, but right now I think we're about 87% of our entire population is double dosed, and it's well over 90% now with first doses. So we're really grateful to see those numbers rise, and we hope to see more. And now that we'll be adding children ages 5 to 11 to that mix, we're hoping that they climb very quickly.
Obviously, New Brunswick is still in the middle of a fourth wave. We're still seeing quite a high daily case count.
Yes.
What have been, in your mind, the biggest challenges of navigating this time in the pandemic? I think for a lot of us, it wasn't how we expected things to unfold this fall, especially with the vaccination rate being quite high. But what do you find the challenges to be right now? So
we know that those who have 2 doses can contract COVID-19. That's never been misunderstood. I think most people knew that. The difference is hospitalizations. And so with the vaccination, the majority of people are not going to have aggressive symptoms and are not going to need medical intervention. However, the higher number of cases we have, the higher potential we have for cases to be admitted to hospital on a daily basis. And that's where we can really struggle with meeting the demand. So we still want those, we made the switch last week to take away the circuit breakers, but now when families have a COVID case, even if they're vaccinated, they're going to have to isolate. We need to get our numbers down so that we get hospital admissions down and are able to keep control of it. And our RHAs have done a tremendous job in keeping control and managing the COVID numbers, whether it be in a regional area or whether we get to a point where we have to work it as a provincial, a provincial management system. But they have done a tremendous job in making sure that our assets are managed well.
How is the booster rollout going? I know that there's different groups eligible all the time. I know even travelers, if you're going for education work or a medical procedure, are now eligible for a booster. Yeah,
autoimmune, deficiencies. If someone has an autoimmune problem, then we want them to get their booster. And I will say it went very well. All of our nursing homes and long-term care were vaccinated. I know there was some question of that last week when Ridgewood Veterans Wing had said that they didn't have their boosters, but they weren't ready for them yet. There has to be a minimum 5-month interval between their second dose and then the booster, and so they'll be ready next month for their boosters. But I think that we really need to ensure that we get, we seem to be having a very good management rollout, just as we did with the first and second doses, and so I expect that all those who need their boosters will have them very soon.
Do hospitalization numbers, I know that's obviously a big concern and factors into whether we roll back in terms of limitations. Do you feel they're stabilizing now? What is the projection?
They're still actually increasing a little bit on a daily basis. We're probably seeing a minimum of 1 person a day being admitted. So if a COVID case is in the hospital for 3 weeks, 1 a day puts our numbers in a concerning level. And our ICUs, I think, are at about 16 right now, if I'm remembering my numbers. So that's significant, and that's a significant amount of person power because every COVID case needs one-on-one care. And so we do have to watch our resources, but that's why the shift now, so that if a household has a COVID case, everyone in the household is going to have to isolate because we know that contact is how this spreads, and we have to limit our contacts. That's the most important thing.
In areas where circuit breakers didn't always seem to be working, what did you find were the biggest factors and why they didn't seem to bring the numbers down right away?
I think it's COVID fatigue. And it's difficult. We've been in this now for 20 months or so. And I think people are tired of restrictions. COVID's going to be with us for a while. It would be naive to think that we're going to be over it anytime soon. There will be a 5th wave. There will most likely be a 6th wave. And hopefully having our children vaccinated is going to minimize those impacts. But COVID's going to be with us for a while longer yet. And we need to try to get our mind around it. Keep our contacts low. We can have a fairly normal life. Even with our COVID reality, but it's just about staying, conscious of the number of people we're contacting.
What are your biggest concerns for the future, be it holidays coming up? I know that the border is going away with the PCR test requirement for short trips, which is great for visiting people, but it could also present some problems as well. I'm just wondering what you have on your radar for.
Well, both of those things are very, very forward thinking in my mind. As I said, we're going to have COVID with us for a long time. Here's what I mostly think about, and that is empowering people. And the POCT tests that are available in community is a perfect way to stay on top of your own personal situation. If you have any kind of thought that you or someone in your household may have COVID, the POCT tests are readily available, and they're really accurate, especially if you're symptomatic. So know what you're dealing with and be part of our solution, as most people really are. That's why our vaccination rates are so high. But it is about containing the spread. And the less spread we have, the better off everyone's going to be. So empower yourself with the point of care test and have it with you and use it.
I'm wondering what you hear from people. I know it's a smaller percentage of people who choose not to get vaccinated, but what are some of the reasons you hear? And is there anything that you could demystify for people who are still on the fence?
There is so much information available in our social media world. And some of it's good and some of it's not so good. And we can't police all of it, and I hate to even use that word police. We can't disseminate all of that information quickly. So I guess what I would ask is that people go to trusted websites, go to places like, our Health Canada sites, go to provincial sites, go to US tried and true places like the Mayo Clinic, or that they know they would have gone to before if they had a question about something. So that's just something we have to deal with, and social media is going to be a challenge no matter what we do these days. Everybody wants information quickly, and they don't always know if the information they're getting is as accurate as it should be. So I promote trusted websites, trusted sites where people can get accurate information. Your health depends on it. Your family's health depends on it, and so does your community. So go the little extra step. There's no real way to take away vaccine hesitancy if someone has their mind set to it. But I believe the numbers are showing. The numbers are showing that millions and millions and millions of people have received their vaccine, many different types. And adverse reactions are very minimal. And on the whole, it is providing our society with the freedom that we want.
Are you seeing with the booster rollout that people are signing up for the 3rd dose when it's available? Or
I can't tell you how many people I ran into who said, I got my booster today, I'm booked for my booster tomorrow. They're excited. They want to stay healthy, and they want to be part of the solution.
I know I asked you about this last week, but are you concerned at all just with COVID, and then we're looking at the health plan as well, that because of COVID, there is some hesitancy among New Brunswickers, I know myself included, to go to the doctor for something that you think might be minor, but normally you would have checked out. Could there be ramifications down the road where we're missing things that could be not only bad for people, but also a major expense for the province going forward? I'm
sure that's possible, but I think more today, people are more comfortable knowing that they're vaccinated, knowing that, at indoor events that people are being asked for their vaccination records, and so I think that on the whole there is more of a comfort, but I'll admit that I don't seek out big crowds as a rule, and I'm careful when I have to be, and I think that really that consciousness is a big part of how our future can be easier. And so as long as people are keeping their social distancing, masking when they're indoors, hand sanitizing, all of those same principles apply today and help keep us safe.
All right, well, I appreciate you sitting down with me today, and thank you for coming by.
That's my absolute pleasure. Thank you for asking me.
My guest today has been the Honourable Dorothy Shephard, Health Minister for New Brunswick. I'm Vicki Hogarth. Thank you for watching Southwest Magazine.